I never thought it would happen to me, but it did.
I was on a 2-mile walk when I started to feel chest pressure and discomfort that quickly escalated, and I went into cardiac arrest.
I felt chest pains, and as I was entering South Miami Hospital, I went into cardiac arrest.
One of the most important connections that I made through the Cardiac Rehab Program was the connection to the WomenHeart of Miami support group.
The WomenHeart group provides great support to make sure that you feel that you're not alone. And every time that we have a new female patient join cardiac rehab, we encourage them to attend. It is really important to provide that support, something that Baptist is well known for. We try to do stuff for the community.
Baptist has been an incredible ally for WomenHeart, and Baptist has also then lent itself to lots of education to the team.
Cardiac Rehab is a monitor telemetry program that is supervised by our medical directors. It provides an outlet for patients emotionally, physically, providing those educational moments while they're exercising, providing that emotional support through WomenHeart. For all of our heart patients, whether it's an MI, so a heart attack, or if it's congestive heart failure, or if it's an open heart surgery patient or a valve patient, those patients, what they're looking for and why they're enrolled in the program is to increase that function of the heart.
I learned about cardiac rehab through my cardiologist and immediately decided to participate.
Cardiac rehab comes with opportunities to examine and to connect with your mental health. And so much of the journey after having a heart attack has to do with taking care of yourself physically and mentally.
I believe it makes a huge difference in their lifestyle and in their long-term prognosis of whether they have a reoccurrence with heart disease or not. One of the most important parts of our job as nurses in cardiac rehab, and the exercise physiologist as well, is that we do follow these patients from preoperative procedures through inpatient. We ambulate with them in the hospital, then therefore we follow them as an outpatient. So it's one of the few times you get to see these patients in a full circle moment.
The Cardiac Rehab Program, I was blessed to get connected with incredible caregivers who really were focused on getting me my strength back when I thought I was broken.
Our goal is to provide great customer service, to provide that service excellence, to be there for our community, to be there for our patients, and showing them that we do want to improve their lifestyle. It's part of what we stand for with Baptist Health.
And so it starts with amazing caregivers who monitor your heart while you do the exercise. And then they're also always asking you about your mental health and making sure that you're both physically and mentally strong after this life-altering event.
The quality of care that I know that I am providing those patients, I know that I am making that difference. I know that our team is making that difference day in and day out. And through that, it makes you want to come back every day to work.
I highly recommend cardiac rehab to anyone who's had heart disease or, in my case, a heart attack. It did give me the confidence to continue on with my life.
Knowing that unfortunately our stories are not as unique as we wish they were, it's important that we advocate and that we stand by each other and we help other women take care of their health.
They know that we are there for them. And you will have lifetime friends, as Marlen and Gigi are.